Welcome everyone who is joining. I'm Katie Dashiell. I'm the Content Marketing Manager at Supplemental Healthcare. And today I'm joined by a really awesome group of experts from our various teams within the company. So we have travel and allied representation, as well as home health and the client side. So we're all just excited for their expertise. So this group is fresh off of TravCon last week. So we'll go ahead and get started with them to kind of let us know their insights and expertise on this. So we'll start out with introductions. I'll have Kristen go first if you could introduce yourself to the group.
Absolutely. I am Kristen. I am a senior regional manager here at Supplemental Healthcare. I've been here for about 6.5 years at Supplemental Healthcare.
Awesome. And then Erica, can you introduce yourself?
Yeah, my name is Erica. I am in the Home Health and Hospice Division here at Supplemental. I'm a recruiting manager and I've been here for about 1.5 years.
Awesome. And then Alicia.
Hi all, my name is Alicia and I am the Director of Regional Sales for SHC. I have been with this company for about 9 years.
Awesome. So basically, we're just going to be answering your questions about travel healthcare. So like how to get started, travel advice, and what we're seeing right now in the market as far as trends and demand. So if you do have any other questions as we go along, please type them in the chat or comment section, and we'll try to get to as many of them as we can. We're also giving away some travel gifts if you do have questions, so be sure to ask them if you do have some, and then we'll get to those at the end. So first, we're going to start with Kristen. So I know travel nursing is a huge one, but what disciplines can travel?
Pretty much any licensed healthcare professional. Obviously, travel nursing is definitely the biggest one right now. RNs, LPNs, even nurse practitioners. But we do also have jobs available for those, plus our allied and radiology professionals. So physical therapist, occupational therapist, speech, x-ray techs, CT techs, and even respiratory. And that's just to name a few.
Awesome. And then we'll go to Erica. How much experience is required to become a traveler?
So experience can vary depending on the facility or state standards, also depending on what your specialty or discipline is. Most of the time we require that you have a year experience in the specialty you want to travel in. For most specialties, and then for home health specifically, you have to have 1 year of OASIS documentation in the last 36 months. For home health, we also offer some refresher courses for OASIS and certain EMRs because they are very specific in what we do. But the more experience you have in the specialty you want to travel in, the better.
Great. And then we'll go on to Alicia from the client side. How have you seen rates change? And then also if you can kind of just tell us what factors can affect a traveler's pay package.
Yeah, so in regards to rates, it's kind of one of those things right now, especially with the way that we're in. The rates are forever changing. A lot of them I can speak to are from the South because that is one of the divisions or the regions I cover more so. The rates are starting to settle down compared to the North just because the ratios are starting to normalize a little bit more in the Southern areas, but it really all just kind of depends. One big thing we are letting our clients know at this time is that it's not necessarily that they're competing with just their local markets, it's nationwide markets that they're competing with at this time. So they do kind of fluctuate just depending. With snowbird season kind of coming, we will see rates going back up a little bit again, depending on the destination area that they're looking for. There is a lot that can impact your pay package, location, cost of living, crisis needs, bonuses. That's definitely something that's going to stem more from your recruiter than the client side per se. But it just depends on the benefits that you choose, if the PTO is available in the state that you're going to. We do recommend working with a CPA or a tax professional when it comes to specific questions like that. It's always good. It's a good idea to decide what's important to you and ask your recruiter what options you have available based on what your why is, why you want to start traveling.
Okay. And then Kristen, what are the benefits of a compact? So like a compact licensure?
It's very beneficial to have a compact licensure. Especially it's been obviously more known for more so the nursing side with RNs and LPNs. Just the ability to be able to work in multiple states, not just the state that you have your permanent tax home in, especially that from what we've seen recently with the COVID-19 pandemic, just the ability to go in between different states very quickly without having to pay some money and wait for those licensures for separate states to kind of come through. Having a compact licensure expedites that process immensely by just being able to kind of grab and go. If you're compliant in one state and have that compact state licensure, you're able to basically be compliant in another state as well. It's that reciprocity. And we've actually been seeing that more come about frequently on the allied side as well. Physical therapy and occupational and even speech therapy have started getting practices in, and it's beneficial for the rest of the states as well to get on board with this compact licensure, because they obviously definitely need the help, and the licensure has been kind of one of the biggest reasons as to why there's been either a holdup or a delay in having that nurse start, is because they're waiting on the licensure to come through. So a lot of states are starting to get on board. A lot of boards are, I know respiratory is trying to get in talks of getting that started as well. But allied is definitely coming through. There's a lot of states that are becoming compact, and again, nursing is compact in a good majority of the states. So it's a huge benefit to all parties involved, for both the clients and as well as the healthcare professional.
Great. And then on our Travelers Week page 2, we have a couple new blog posts that are about those ones that have just formed, like the OT Compact, and for the SLPs as well. So that's great information. And then Erica, what happens after a traveler completes an assignment?
So I know I personally handle, all of my talent. I start asking about halfway through the assignment, are you liking where you're at? Are you going to want to stay? Do you want to move on? If you want to move on, where do you want to go? And it's just about opening that communication with your recruiter. We're here to help you. That's our job. So if you have vacations planned, and you have goals for yourself on where you want to be, just keep that communication open. Tell us where you want to go, and I'll start watching for, open jobs to come through for the places where you want to go next. Another benefit is you can actually take a break up to 30 days off in between assignments without losing your benefits, which is definitely a great asset to have as a traveler.
Awesome. And then we'll go back to Alicia. What is your advice for travelers right now?
I think right now, again, kind of like I was saying before, the market's forever changing, and it's definitely different now than it was 6 months ago, a year ago, 2 years ago. Again, I've been here for 9 years. So what we did then and what's going on now is totally different. Best advice I would say is to be more flexible. The more flexible that you can be for your contracts, again, your why, is it a destination? Is it money? Is it pay? Is it shift? But depending on what it is, the more flexible and open you are, the more contracts you're going to have available to yourself. My advice truly is to figure out why. Why do you want to travel? Again, is it money? Is it destination? Is it you have family that you want to see? If it's money, chase the money, but know that it might not be your first pick. It might not be the shift you want. It might not be the exact location you want, but you're there to make the money. We always joke that Hawaii, it's a traveling vacation. You're not there to make money, but you're on an island, you're in a beautiful place, and you're going to make memories. So just being flexible is probably the best thing. Trusting your recruiter that they're going to help guide you on the right assignment is also huge. I'm going to kind of make a joke of this, but I think a lot of people forget that we are actual human beings on the other side of that computer or the cell phone or whatever. So realizing that we're people too. Make a relationship with your recruiter, build that trust so we can truly help map out your career.
Awesome. Yeah, that's great advice, and definitely about certain locations being less about the money. But if you are interested in the money, that might just be a different location or assignment than you're thinking. So just a question, I guess, for all of you, which is kind of what we talked about in the beginning of what trends are we seeing? So what part of the country are you currently seeing the most needs in? And what is the demand as far as like disciplines and specialties? I know you guys kind of all have your own divisional viewpoint on this. So I'll start out with Alicia again for that.
Yeah, so client side, as I mentioned before, the South is going to start to see an uptick in needs just with the winter season kind of coming upon us. Honestly, there's needs everywhere. People want to get out of the snow, so they're going to come south, they're going to go west. But then you're going to have the people who enjoy skiing and being outdoors during the cold. Those needs are going to see a rise too. I would say it's more so right now. A lot of these facilities are really looking for labor and delivery nurses, mother baby nurses. The ORs, they're definitely opening back up since a lot of them were limited and or shut down during COVID. So OR nurses, they are hot commodities right now. If there's anything that I would say put a focus on, if you can, if you're a labor and delivery nurse, if you're an OR nurse, definitely reach out to agency. They are desperate for you right now.
Okay, good to know. And then Erica, from the home health perspective, what would you say are the current needs?
Yeah, so right now, if you're, rate chasing, our biggest rates are going to come in the West, but so does cost of living. So that's the trade-off there. And also up in the Northeast, like Massachusetts has been incredibly hot for RNs for us. And as well as the Carolinas. I feel like this time of year, we start to see the shift as well down to the South with all of our snowbirds. Being from Michigan, I totally understand. And it's just one of those things where we just got to get the jobs to start opening to, come with the snowbirds. So here we should be seeing a shift pretty quickly.
Okay, and then as far as the allied health side, what would you say for that, Kristen?
Yeah.
Well, we definitely had seen a huge drop in it since COVID kind of hit and everything. A lot of the outpatient clinics were shut down with just due to COVID and everything. So we are starting to see quite a big rise in PTOT and speech needs. Mostly right now, I've been seeing a lot of outpatient here in Texas. That has come up, as well as Illinois in outpatient clinics. And we've been seeing a lot of skilled nursing needs continue to rise along the Pacific coast. So California, all the way up to Washington and Oregon as well, are probably our biggest needs. And kind of like what Alicia was saying, with winter season coming upon us, we're going to see a huge uptick in, as far as with the cold and flu season, we're probably going to see a lot of big demand for respiratory therapists come through here in the next month or two, I think.
Yeah, and then to kind of play off Kristen, it's kind of funny. Allied across the country for home health is actually starting to pick up post-pandemic.
Very much so.
And it's a nationwide thing. Like we're seeing increases in our needs for OTs, PTs pretty frequently at this point. So definitely something to think about if you're an allied.
Yep.
Good to know. Okay, well, we'll see if any other questions come in live. But while we're waiting for that too, kind of just one other question that I can kind of answer, which is just how to keep up with new jobs in real time. And supplemental healthcare is actually in the process of launching a mobile app, which is really exciting for us, so that our travelers will be able to see new jobs in real time and they can search for their desired location and experience. So you can currently and will be able to sign up for job alerts to be notified about new jobs that fit your specific search criteria. Your recruiter can help set that up, and then also to get you submitted. So that will be really great once we have that mobile app, but currently you can work directly with your recruiter and get job alerts set up for that too. So staying in communication with your recruiter, like you guys said, is really important so you can get submitted faster and increase your likelihood of getting the job that you want, because obviously it's still pretty competitive. And there's always needs though in travel. So there's plenty of opportunities for current travelers and those that are interested in it. So it looks like I am not seeing any questions come through, but if you do have them, this will be a recording, so we will post it afterwards so you can respond to the email, or again, put your questions in the comments. We'll still be offering some travel gifts for those questions we get, and I can follow up with the team to see if they can answer any questions that might come through. But thanks again, ladies, for joining me and answering some of these top of mind questions. And I'll be sure to follow up with you if anything else comes through. But thanks everyone for joining, and thanks everyone for your help on this.
Thanks.
Thank you.
Thank you.
Guys.